Okay guys, you know I'm a big proponent of minimally invasive foot surgery. Past 3 to 5 years, MIS, which is minimally invasive foot surgery, has been gaining more interest, obviously huge demand by patients. Patients now, they want a whole part of the body minimally invasive. Knee, hip surgery, foot and ankle, no exception. Especially nowadays, surgical system which requires quite expensive hardware fixation system, they're under kind of investigation now. So the way I do minimally invasive foot surgery, very little use of hardware, if not any. Bunion, hammer toe, middle foot, even retrocalcaneal exostosis, which is the bone spur on the backside of the heel, that can be all fixed with a minimally invasive way with little or no use of hardware. That's why I'm gaining a lot more inquiries from our colleagues. But I'm not just teaching theories. How I help colleagues implement minimally invasive surgery, because I see this benefit not only for patients but also as a practice owners or podiatric physicians and surgeons or foot and ankle surgeons. As far as the growing your practice, you can do these procedures, most of them in-office setup, which is like here. This is my in-office office-based surgical suite. See, I got the mini CM, and then it's about 15 by 15 room, and in here I can perform pretty much most minimally invasive foot and ankle surgery, all surgical drapes, sterile drapes, everything's sterile. So I keep the high standards, and patients love it because they come to my office suite instead of going to big hospital, worry about other infections or waiting for turn, or worry about huge bill from hospitals. So anyway, how I help my colleagues implement, not only I have a mentorship program that you can access, like multiple depth of minimally invasive foot surgery procedures in detail in video course. We also meet every Thursday night, and then we discuss about 15 to 20 MIS cases done by our members every week. And of course, MIS, you need a hands-on skill set. So through my program, I offer private group Cadaver Lab for doctors who are new to MIS or improve some skill sets. We offer 6 times a year private, very small group, private group Cadaver Lab Workshop. It's this great opportunity, very hands-on. Each attendee will receive their own cadaver leg to work on. And then the advantage of being in this type of private hands-on level, it's critical. I also have once a year the big event, International MIFAS Cadaver Lab event. Now it has been the largest MIS Cadaver Lab conference in the United States. We had 100 doctors in 2022. I've been doing this for 5th year in a row, and then every events were sold out. This video, I'm going to show you what others are going through in our new advanced MIS Cadaver Lab Workshop. I started offering once a year, gather to Chicago, and then we had 25 doctors this year, and we had it for 2 days. Instead of 1 day workshop, 2 days, both days cadaver lab. Each day, each attendee will receive cadaver lab, and then they work on more advanced techniques. Now, MIS again has been performed thousands times by hundreds of orthopedic surgeons and podiatrists all over the world. Now, if you are in denial that you think MIS is like old way or anything like that, you got to rethink. You got to change your mindset. The whole world is going MIS, and MIS is not going anywhere because MIS really aligned perfectly with current medical economics and medical dynamics and patient demands. MIS procedures have been proven to be effective as traditional open procedures. So in this video, you will see what other colleagues are experiencing in my advanced MIS Cadaver Lab I recently held. Enjoy these testimonials and other doctors sharing their experiences.
My name is Dr. Boris Markevich, and I'm here in Chicago at TJ's Cadaver Lab for minimally invasive foot and ankle surgery. It's a 2-day presentation, 2 days of Cadaver Labs, so we have about 20 representatives here. I'm an instructor at this seminar, and I've been instructing for 25 years maybe, and this is one of the best places to come to get training on minimally invasive foot and ankle surgery. Not only are the best world-class instructors here, but the people engaging here are all very positive, very dynamic, ask the right type of questions. It's a priceless experience that is worth every penny. Hope to see you in the future. Thanks for your time.
This was fabulous. I don't think anywhere anyone has ever done 2 days of minimally invasive surgery with 2 separate cadavers anywhere. It gave us a chance to not only try new techniques, but really perfect them, because we had that second day. I just think it's been great, TJ, and I encourage everyone to consider coming to a 2-day event. Fantastic. And of course, Dr. Isham, Dr. Markevich, Dr. Milchin, it's been fabulous to have those kinds of seasoned and renowned professionals here teaching everybody. Great, great, great environment. Thank you.
Oh, amazing! I learned. I always take stuff away, but this 2 days has been amazing. Learning from some of the best MIS surgeons in the world. We're very blessed to be here, and I love it. It took a lot away from the 2 days.
Okay, Ashim, would you recommend this to other colleagues?
Absolutely, without a doubt, 100%.
Well, I learned, so I've been trying to learn procedures that you don't need to use a C-arm in the office. So the tarsal tunnel release has been really good, sinus tarsi, the heel decompression, all of those, and then neuroma.
It's wonderful.
And then just refining the techniques in the forefoot.
So things that you can immediately implement in an office-based setup.
For sure, yeah. This week.
Oh, nice.
This coming week, yeah.
It was awesome. Learn something new every time with different instructors. Everyone has something different to give you. It's great. Highly recommend.
What I like to say to my colleagues is, I don't know, it's maybe 3 or 4 times TJ, and I think each time my skill set is improved. From just a basic tenotomy to hammer toes, to plantar fascia releases. This particular course is the advanced course. I would highly recommend it. This gives you, we had the didactic, but this is hands-on, 2 days hands-on. And I think after we assume the basic skills, you need hands-on. And 2 days with a limited amount of docs here. There's 20 docs here, 2 cadavers. I don't think it gets any better than that. And after doing this many years, this is truly the best. For hands-on and perfect those skills. TJ, it's an inspiration, and I'm always fired up when I go home. Because I see my colleagues working with you and the opportunity and the camaraderie, and anyone that wants to learn MIS, from the beginner to the advanced, this is the place to go. Hands down, the best seminar. Thank you so much, TJ.
Doing a percutaneous tarsal tunnel release.
And how's the experience at this Cadaver Lab this time?
It's been extremely good.
You like it?
Yes.
Would you recommend to some other colleagues? Would you recommend to other colleagues?
Oh, most definitely. This is the best Cadaver Lab.
I'm doing well. Experience is going really, really good. Still trying to learn more and more, but it's very good instruction, and just great experience overall.
Awesome. Would you start implementing helping patients?
Yes, I will. Yes, I will.
Thank you so much.
And I will be at every conference as well.
Beautiful.
Thank you.
Excellent. Every time I think I've been to the private cadaver workshops and all the events many times, right?
Right.
But we always learn something, get some tips out from the master. So it's a great learning experience every time that I get it.
Experience has been great. Learned a lot of new techniques, and I can't wait till the next one.
Oh, marvelous. For somebody with a little surgical experience, this is indispensable. You cannot do without Cadaver Lab. I'm thrilled.
Beautiful.
Thank you very much for setting up these things.
Oh, you're welcome. You're welcome. Keep up the great work. You're working on MIS hammer toes?
Yes. Okay.
Awesome. Help many patients.
I'm trying to work on my first patient here.
Awesome.
Okay. Try to get the technique down.
Okay, so we're finishing up the advanced MIS Cadaver Lab. I hosted and organized this, and then I brought the 3 great MIS top experts from the world. And here's a Harley. Can you share us like what your experience has been, and then just say a couple of words for everybody who might be watching this video?
Well, absolutely. I believe in what you teach. You're a true inspiration to MIS. This particular mastermind course I enjoyed very much because it was a smaller group. They had 2 cadavers per attendee, and we were able to give truly personalized one-on-one hands-on experience. So the people who attended this particular mastermind class are going to walk away better skilled than when they came. So I'm very excited to be part of this, and as I tell you all the time, I'm so proud of what you do for our profession.
Oh, thank you so much. Come more often.
Thank you.
Awesome.
Invite me.
I hope you enjoyed the experiences that other doctors shared at my event. Now, if you want to learn and implement minimally invasive foot surgery yourself, contact me. There's a description below how you can contact me through email or going through my website, or watch other webinar replays I place there as an additional resource. And if this one is something that interests you and hey, I want to really implement minimally invasive surgery, look no further. I have a proven system. I've trained over hundreds of doctors already. So come to either my Cadaver Workshop or join my MIFAS Accelerator, and then I will see you inside of our membership community.
First class, as usual, 5 stars, all the way. Always pick up something new. I've done 15 of these labs now and have 38 years of experience. TJ's changed my life, so please do yourself a favor, take one of these courses.
This is the top seminar lab to do in the country, by far. Been around for 27 years practicing. This is it, guys.
Thank you so much, Brian.
My pleasure.